Hello and welcome to another exciting episode of Community Report. I am Dari Idu. The use of herbal medicinal products and supplements has increased tremendously over the years, with not less than 80% of the people worldwide relying on them for some part of primary health care. Dosage, regulation, efficacy, and potential adverse reactions are often listed as some of the concerns arising from the use of herbal mixture. But those who have studied and picked strong interest in this branch of medicine have argued that you don't throw the baby out with the bathwater. Does the good outweigh the bad? What is the place of research? How can regulation help? On this episode of the program, we'll take a deep dive into the world of alternative medicine to find some answers. The surge in acceptance of natural therapists is growing even among developed countries. Scientists and medical professionals are developing more interest in this branch of medicine. It is estimated that up to 4 billion people, representing 80% of the world's population living in the developing world, rely on this medicinal product as a primary source of healthcare and traditional medical practice. In different communities, there are those who consider the use of herbs as an integral part of their culture. Turmeric, ginger, garlic, and other organic products are the common ingredients. China, Ghana, Mexico, Russia, South Africa, Nigeria are among the list of countries where alternative medicine is in frequent practice.
Like moringa, bitter leaf, and the scent leaf. If I have symptoms like malaria or BP, something like that, I will go and boil it. I remember since 2019, I've never go to hospital to say they take all this shock where they give us.
If I am preventing malaria, I take traditional medicine. But if I'm already down with malaria, I take orthodox medicine. So they play different purposes.
For example, let's say pile. Like me now, I take bitter leaf and scent leaf, that osimum. So, and the combination works well.
Herbal medicine has been challenged by practitioners of mainstream medicine because of the lack of scientific evidence, especially detailing processes, despite its long history of use. Orthodox medicine is the mainstream model of medicine where doctors and other healthcare professionals treat people based on their symptoms and diseases. There are arguments that this brand of medicine is suppressing the knowledge of traditional medicine. But there is also a blend of both worlds as some medical practitioners continue to dig deep, seeking new knowledge. Adebukola Adefule Ushitelu, a professor of ophthalmology and chairman Lagos State Traditional Medicine Board, operates on both frequency.
Presently, the board derives its legal backing. We are backed by the Reform Law of 2006, by the Lagos State House of Assembly. And the Traditional Medicine Board is mandated, actually, to regulate the traditional medicine practices in the state. And according to the WHO definition, like others, like India and China, even in European countries, you see, that traditional medicine practices are actually recognized, respected, and they are being practiced. People are, they believe in them and they are efficacious. And in Nigeria, unfortunately, colonization has affected the perception of the average Nigerian. They think it is fetish. It is not fetish. My people will say I have tested it. I am in it. I have experienced it. I know how it works. That's where I found myself. Because I now belong to the two parties. I reached the peak in the Orthodox as far as ophthalmology is concerned, because I did surgery, medicine, and then went to specialize in ophthalmology. That's to do with the eyes. So having gone through all that, it got to a stage. If you don't do research, if you don't publish, you will perish. No promotion. So I got to know about this traditional medicine. There was a particular patient who was coming with eye problem. He had glaucoma, and he made sure I would see him. He was never in a hurry and everything. So he was the one who gave me. He said, have you noticed that you've never asked me to come for surgery? Have you noticed that my eyes have not been getting worse? Even those who have been operated, they still have problems. And better than most of them. I want to give you what I've been using because it's a family problem. I laughed at it and I took it, the normal concept. It's fetish.
At the height of COVID-19, people from Nigeria, Madagascar, Zimbabwe, Tanzania, and other African countries developed homegrown solutions hanging on to traditional treatments. Madagascar even went as far as developing an herbal tonic touted as a cure for COVID-19, but the World Health Organization warned against using untested remedies and insisted that the claim of the product is unproven. In Nigeria, a similar effort was made, but how far did it go?
During the COVID period, we were blessed with some, preparations to use, and this was subjected to animal experiments. We got a grant from TED Fund through NAFDAC. And yes, we got, through NAFDAC, and we did clinical trial study, and, it's already listed. Mixed, yes, and it's, that's NAFDAC approval on it. So the Lagos state government tried a lot with the WHO, directives, but back home, we too tried our best, and that contributed immensely to the low incidence of, COVID and mortality.
So was this taken as a treatment for COVID at any
Yes,
point?
yes.
Because at some point I think NAFDAC had a problem with a traditional solution to COVID. You can't call this a vaccine, of course.
No, this is not vaccine. It's a mixture.
Okay, it's a
Yes.
mixture to treat COVID.
Yes.
And it was accepted by NAFDAC.
Yes, you can see
Went through the
the
scrutiny and
yes,
all of that.
everything.
So was this administered at any point?
I told you we did hospitals. The government will not allow us to go to the hospitals, but the patients we saw outside, we treated them. Okay.
So how difficult has it been to get this handshake, like where government?
That's why I'm saying we are not getting enough. The government has been magnanimous enough to have included, to have inaugurated the traditional medicine to be part of the healthcare, sector, system. But it still needs to do more. One, we need infrastructure that will give us the grace, the impetus to standardize all our preparations. All those ones they were hawking before, and we need to standardize all of them.
I think
And then-
quackery.
Quackery is already, much down. Oh yes. Oh yes. Quackery is much, dealt with already. Just like the Orthodox is fighting quackery. Yes, a lot is, being done. Because these hawkers, they are now, in their associations, they know that the traditional medicine board will come after them once we know that they are doing something that is substandard. They know that already. And that's why they are now coming in large numbers. Only yesterday, we are tested about 90 of them. And we do that, almost every, 4 weeks.
We did see.
In the zones.
We didn't see any need for other states to replicate what is happening in Lagos.
It's very important. It's very, very important. Very, very important. Lagos is always in the forefront, but when you do it well, when Lagos does it well, others follow. Already, Lagos State, we have helped Rivers to start off theirs. We have also helped Ogun to start off theirs. So those 2 states. This is, third fund funded, and at the same time, NAFDAC
So from what you
approved.
noticed, what about WHO? What's their perception, or what's the body language to things like that?
WHO, the pharma world, I will say. I won't say WHO.
Okay.
It's the pharma world
Okay.
that is the big problem. Their products must come first. Any other one, they would downplay. Madagascar preparation, very, very active,
Quite potent.
potent and efficacious. But the pharma world will rule. So we are still not fully liberated. We are still being driven in their direction. We need to stand on our own and hold what we have firm. Appreciate what we have.
And like they say, old habits die hard. So you should keep it the old way, especially when it comes to.
Don't worry, we are penetrating. We will win. Oh yes, we are penetrating. We will win for sure. The best of traditional medicine will surface, and it's going to take over. The best of traditional medicine, unless they say, Mechon, go and keep quiet. We don't want to hear you again. But if they allow us, the best of traditional medicine, it's cost effective, less, complications, less side effects when done in the standardized way, in good measurement.
Herbal remedies have been handed down through generation for centuries. Mudashiru Risikat, who sells herbal products at the new market in Agege, says every member of our immediate family is into the business. Trained by her parents, Risikat earns a living for preparing herbs for those who consult her. She gets to prepare these mostly for ailments like malaria, typhoid, pneumonia, diarrhea, ulcer, and other common sickness. Vendors like Risikat are certified by the state government. Herbal aphrodisiacs and alcoholic bitters are littering shops and kiosks, fast becoming drink of choice for many. It may also interest you that many of these products are listed on global e-commerce sites, from aphrodisiacs to immune booster, promising a lot, but how much do they actually deliver? Are they scientifically backed? Some of these questions are what I've also posed to experts.
It starts from home. We check our children, we check the youths, we check ourselves. There must be moderation in anything that we do. I don't know why anybody will engage in overdoing things. Too much of everything is bad. The only thing is people are not checking themselves. It's gross indiscipline. It's gross indiscipline, and it is not only sin in the traditional. We have them in the Orthodox too. When you say somebody is addicted to some drugs, cocaine, these are Orthodox, drugs. I know some doctors who are on cocaine. I know some doctors who sniff. I know some doctors who drink in excess. So it's not only in the traditional. The thing is discipline. I think we need to inculcate this in our virtues, generally, not just only in the traditional, also in the Orthodox. Quackery also, exists in the Orthodox, just as it is in the what is it? It's in discipline. That's one thing we need to, emphasize on, and then make sure it starts from home. Discipline your children. Teach them the way they should go. Some will still, be out of, the system. They will overdo things. You have them, and that's why you have the psychiatric home. Psychiatry is also Orthodox, as well as traditional. And drunkards. We've had drunkards even before the white men came. Africans were doing neurosurgery far back in 1873 without anesthesia. Yes. When you take something and you see that it lifts you up, and then you now indulge in constant use, you become addicted. But good enough, we have some of them who are preparing things they should not prepare, especially in the bus stops, and that's where the training is now becoming more effective. They are being warned that should, in case any of them is caught, they'll be in trouble.
The National Agency for Food, Drug Administration and Control, NAFDAC, continues to warn against these products.
Most herbal practitioners do not lace their products with unapproved dangerous substances. But in terms of synergy, we have meetings with our herbal practitioners about twice a year. We communicate with them, of course, through the registration, through inspection directorates, because we have to inspect their site anyhow. So we have synergy with them. But please do not walk out to think that herbal medicines are bad. Almost all the products that we registered are safe. It is only an exception. The problem is unregistered products, and their aim is not to protect the health of our people. That is why they are not registered. So there is synergy. In terms of preempting, rather, that is, the preempting is done through stakeholders meeting. And of course, they know, the registered manufacturers know our rules and regulations. Then the second from Sun, post-approval, what is the frequency of PMS monitoring, how often? We mop up all this nationwide. Investigation and enforcement does destruction exercises at maybe about 4 or 5 times a year. We cannot do the exercise every time because we have to gather a lot so that we save cost in doing that. As we speak, we are getting ready for one in the Northeast. We are getting ready for the Southwest destruction, where all our states we bring their seized products and then we destroy. So we do mop. In terms of staff, we need more staff, because it is the staff that we go to ABC, shops or whatever. We need more staff, and the government is responding to that. We cannot do this job alone. The citizen that called and asked how can NAFDAC register a product and is driving people crazy, that led to Japata. It is a citizen that was concerned. You are very familiar with us. You can call us. We cannot do this job alone because it's so widespread. We are working in a particular state now. Our staff went there, and when they were going, they were driving them into the bush, the people that wanted to show them. When they got there, they see a building. They were able to shut the building down, took samples. The other is like a camp without walls, just a roof, like a big camp. And you see tens and tens of huge pots. I don't know how many people have died. How many people have started having kidney problems? When the kidney cannot handle substances, those substances that are retained in the kidney start damaging the kidney because they cannot be filtered out. This is what we need, especially the media and all the citizens that are listening. We need you to please call us. Walk to the nearest, NAFDAC office. The intelligence about this Kokura, we got it few days ago, and a lot has happened. So please, the Japata was from Lagos, and we shut the company down immediately. The Kokura manpower, they are Southwest, Zaria, Kaduna connection. Any body that we found in the company, we arrest them. We bring them to Lagos. But there is a protocol in terms of you cannot you cannot arrest them for more than X number of days before they get bail. So they are being bailed out, and the investigation is going. For the Japata, we are looking for the owner, and the owner is on the run. So the case is not closed.
As the global use for herbal medicinal products continues to grow and many more new products are introduced into the market, public health issues concerning their safety are also on the increase. Health experts continue to warn that it is better to consult health professionals to ensure proper dosage, understand potential side effects, and watch out for reactions with other medications when taking herbal supplements. And that's our show for today, everyone. If you miss any part of it, you can watch it on our YouTube channel. You can also follow the conversation on the social media platforms displayed on the screen. Thank you very much for watching. I am Dari Idu. See you next time, and bye for now.